So as I said, I gave you the general symptoms of cancer. Now, to be very specific, it is very difficult. As I said, there are more than 200 types of cancer. But just as I said, a lump which is painless and which is slowly growing in size, a nagging cough which does not heal, bleeding from any part which should not happen, a mole which suddenly changes its characteristic, inability to swallow, and change in bowel or bladder habits. These are symptoms which are general, and each cancer has its own symptoms. There is also something that we do called as screening for cancers, and that is one point that I missed and I must stress on it. Is that there is a preemptive diagnosis. So there are health checkups available, and especially in certain cancers like breast cancer, you can undergo a mammography. A mammography is an X-ray designed to diagnose cancers early. 90% of lumps less than a centimeter are diagnosed by mammography. Mammography should be done by all women annually between the age of 50 and 65. After the age of 40 to be done once in 2 years. Then the second test is pap smear, which is for cervical cancer, cervical cancer was in the news recently because of two reasons. One, because of the budget, and secondly, because of a film actor who pronounced herself dead. So, yeah. So apparently she did it for awareness. So apparently the intention was noble. So that is these were the reasons why this is the second test that can be done for males. PSA, that is prostate specific antigen, that is a blood test that should be done in males who are above the age of 50. And if there is a specific symptom, that is, suppose there is a change in bowel and bladder habits, a stool examination, something as simple as a stool examination should be done. X-ray if you are a heavy smoker, and oral examination if somebody is chewing tobacco and is continuing to chewing tobacco. These are the things that one should keep in mind for screening of cancer.
Does cancer relapse?
So cancer can relapse. In fact, any chronic disease. A lot of times the relapse word is used in terms of cancer, but remember, even diabetes relapses. Even diabetes doesn't really technically get cured. Hypertension doesn't get. So all of the chronic diseases, heart attack. So even after undergoing a bypass, can a heart attack happen again? It can. So basically, any of the chronic diseases can relapse. So can cancer. So it depends upon the stage at which it is diagnosed and the completeness of treatment that the individual undergoes. So a lot of times we find that people take half treatment, then they leave, then they try alternative treatments, and this is something that should not be done. It has to be done in one go. Only then we have some chances of cure.
Thank you.